And I think this is a very phenomenal time for us to actually kickstart again for 2021, our webinar series. So I'm actually very excited to have you all here today. This actually is the theme for the accreditation day tomorrow. It says supporting the implementation of the Sustainable Development Goals. And I have around the theme itself, I have the 17 Sustainable Development Goals. And the one that is of particular interest to us is number 3, which is good health and well-being. That's the one that is particularly of great interest to us today. Because we are in the medical fraternity, and specifically, we're going to be looking at medical laboratory. So looking at medical laboratory, good health and well-being, we're all familiar with this slide at some point of time. And the standard associated with this is the ISO 5189, the 2012 version, which is actually the 3rd version of this particular standard. With me today, joining me is Reverend Father Dr. Okori Samuel, all the way from St. John, the 23rd Hospital, Aber. Please, Father, could you please turn on your video so that you could be seen for a few seconds? Thank you. Welcome.
Thank you. Thank you.
Okay. And then there is Dr. Muwanga Moses from the Entebbe Regional Referral Hospital. Dr. Moses, please turn on your video for a few seconds so that we could see you. I hope you're not on mute or you lost some connection there, but hopefully we'll come back to you in a few seconds. So accreditation and the Sustainable Development Goals, and as I said earlier on, Sustainable Development Goal number 3 is of particular interest to us because it talks about healthcare, and we are looking at laboratory medicine particularly. And I have with me both doctors joining us. So behind the accreditation are 2 very great corporations. There's the ILAC, which is the International Laboratory Accreditation Corporation, and the IAF, the International Accreditation Forum. And together, both of them are put together this great commemoration of the Accreditation Day, which basically, in their words, is supporting the delivery of health and social care. So when we talk about ILAC actually does something really crucial, and it uses the ISO IEC 17011. In accordance with this standard actually looks at conformity assessment bodies, requirements for accreditation, or accreditation bodies, accrediting conformity assessment bodies. So in accordance with this particular standard, ILAC is able to accredit other conformity assessing bodies. And in this case, I'm looking at 17025, which is for calibration. 5189, which is the one we know very well. This is for laboratory medicine. 17020 and 17020 for the bodies, and 17034. This is the standard that is used by proficiency organizations to do EQAs. Then on the other hand, we have the IAF, the International Accreditation Forum, which is a worldwide association of conformity assessment accreditation bodies. And its primary utility is to reduce risk for businesses and customers. So it embodies all the accreditation bodies, but while it embodies all these accreditation bodies, it wants to ensure that both the accrediting bodies and the customers, the risk to them is actually minimal. It says accreditation assures users of competence and impartiality of the body accredited. And this is very important to note because we're going to be talking about the accredited laboratories that we have in country and all the other accredited laboratories that exist all throughout the world, the ones that have been supported by Global Healthcare Public Foundation. It barely says that there is a very high level of competency in these laboratories, and there is very high ethical and impartial standards that are followed by these laboratories. So I throw in this slide because this is a very, very important slide when we're thinking about all that is going on in the accreditation world. The International Health Regulation, commonly known as the IHR report from 2018 and 2019, is actually supported by 2 World Health Assembly resolutions, WHA 61 and the World Health Assembly Resolution 71 of 2008 and 2018, which requires the World Health Assembly to report on 13 core competencies that allows the different countries to say that they are ready to prevent, protect, and respond to any emerging diseases such as COVID that we just recently are going through. And I show you this slide because of particular attention is the fact that core competency number 5 is about laboratories. And so when you look at the International Health Regulation, when in all its core competencies, it actually goes out of its way to actually look at laboratories as a core competencies that all the bodies should be reporting to annually. So between 2018 and 2019, which is what this slide depicts, you notice that the actual movement in the core competency number 5, which is laboratories, there was actually a 1-point move. And I'm so tempted when I look at that 1-point move to say that that 1-point move is actually as a result of all the labs that have been accredited in the country of Uganda in the last 2 or 3 years. A few of them across the continent have actually made that 1-point move because for the most part, developing countries and the lower income countries have not made much progress towards accreditation. But in terms of supporting the Sustainable Development Goals and the IHR, it is important to note that core competency number 5 deals with laboratories, which actually goes to support the SDG 3. Next. Which goes to support SDG 3. Now, this is a graph. This slide basically shows you some things that have happened here in Uganda, which is where I'm actually speaking out of right now. In the last 3 years, 16 laboratories have actually been presented for accreditation. And of the 16 laboratories that were presented, one is still recommended, but one of them is actually accredited to 17025, which is a calibration standard certification. That's laboratory number 15 on the list. But when you look to the extreme right, this is what actually makes this worthwhile, is the fact that in this shorter time, with 15, 16 laboratories accredited, the direct impact of this accreditation process, and again, recognizing that the impact actually here is impartiality to fair and quality treatment, competency of good health, has actually reached about 4 million people in the country of Uganda. So basically what we have therefore is a good number of people who actually have access to good health. On the African continent, the number of accrediting bodies that we have Egypt, EGAC, we have Ethiopia, we have Kenya, Kenas, Mauritius, SADCAS for the SADC region, TUNAC for Tunisia, and then SANAS, which is the recommended body for accreditation in the country of Uganda. And then there is SOAC, which is for West Africa. They haven't actually met their MRA statutes yet, but I threw them on because I'm looking at all the bodies on the continent that have the potential or are on list. So now with this, I will now call on Dr. Muwanga to please join me as we talk about accreditation and the SDGs, but specifically, let's have a conversation about what is going on with your laboratories at the Entebbe Regional Referral Hospital, and what have been the gains that you could talk about, or your journey in the accreditation process. Over to you, Dr. Muwanga.
Thank you very much. I'm Dr. Muwanga Moses, the Director of Entebbe Regional Referral Hospital. I'm happy to share with you the journey of how the Entebbe Regional Referral Hospital lab has gone through. Ideally, before the accreditation, our lab was serving over 6 districts. And ideally, before that accreditation, we didn't have a clear management system. Neither did we have a clear protocol of how to manage. We didn't have proper pre and post examination systems for the lab. there was no clear management systems for even small complaints of our internal and external customers. Overall, we didn't even have a specific goal. Our lab was just doing laboratory services, but we didn't have a clear goal and objective of how to manage. Accreditation, before accreditation, we had many tests we were doing, but there was no clear menu of how many tests we were doing in the lab by then. There was no clear system also of managing equipment as well as reagents. We didn't have joint managerial review systems, we as management as well as the technicians in the lab. Then technically, the lab didn't have proper quality management system. The personnel in the lab, fine, they were employed and working as laboratory technicians, but they didn't have proper personnel management as per the lab, even no clear protocols. But as we went through the journey of accreditation, which I personally was involved, we had to find, there are so many benefits which the lab got. Ideally present where we are, Entebbe is managing the COVID patients. And ideally it's one of the hospitals which is managing the most of the critical number of those COVID patients. And one of the reasons why we're managing those patients is because of our lab being accredited. Our lab is internationally recognized because our tests which we carry out are recognized internationally by SANAS. We got many collaborators we are working with now, including international collaborators. I think there's a university we are trying to write research protocols with them to ensure that we start some research studies within the hospital, especially for the antimicrobial sensitivity for the drugs. Locally, we have many medical schools which have attached their students to have hands-on because our lab has proper protocols, proper systems. So when these schools came around, they found that they can have their trainers, undergraduate trainers, be oriented within our hospital. Our hospital has also had an opportunity for benchmarking. Many of our local hospitals, Mitiana being one of them, Rubaga Hospital, Mengo, and Ginger have come to benchmark to see how we went through the journey of accreditation. On ground, clinically, our clinical diagnosis have improved, the patient care. Entebbe Hospital is acting as a hub whereby many labs, many smaller hospitals around, they can bring in their samples and then we help them, as well as being a reference lab for those lower hospitals. Personally, our lab personnel have been mentored in quality management. The clients also have a way of raising their complaints, and these complaints can be handled easily. I think overall, being accredited, it has helped us in managing this pandemic because the whole system has been very positive on our side. We have had competences. We can manage many of the tests. I think the accreditation journey has been very beneficial for us as a hospital. Professor, I think for the meantime, those are some of the areas which I can share with you. Hello?
Hello? Yes, Dr. Muwanga, those are some very exciting things that you actually are addressing. And I'm particularly excited about what you've been able to do with the COVID testing and the management of all the patients that have been coming to you. That's a very big process. But would you be able to just say something that addresses the whole management systems in terms of you build a strong management system, you actually make a reference to the whole idea of the management review. Would you be able to tell us something around the management review and how it has made your system stronger?
I think the management review is the lab itself. It has a quality manager. It has the lab manager. It has different heads of department. There is a biosafety manager. And there is also an internal auditor within the lab. These people at the beginning, they come up with objectives. What areas are we improving as a lab? So these areas are agreed on and the targets are set. So at a particular moment, we always do it every 6 months. We have to carry out a managerial review. A review, we call in all stakeholders. The stakeholders, we hold a one-day meeting. The lab, the different departments I shared with you present their performance, the lab performance. In case of the internal auditor presents, these are some of the areas we agreed on. When I carried out an internal audit, these are some of the areas which failed. The biosafety manager also presents. The quality manager is a very crucial person who presents the overall performance of the lab. He has presents the targets. What menu are we supposed to present? I think we have a menu of over 10 tests we carry out in the lab. What is our turnaround time in the various areas? And then we discuss. There are some areas which are technically, it is a technical requirement which we need to improve on, or it may be a managerial requirement. The good thing with the management review, it brings all the stakeholders around. The lab team also appreciates where their performance are. And then they can also raise issues, whether the management, they need some help from the management, or they just need they themselves as the technicians to improve. So I think out of that, we can identify some of the non-conformities, things which didn't go right. And then we set up corrective action for the next managerial review. I think accreditation helped us to come up with such monitoring system. And then on particular intervals, we can sit and review ourselves. And then we keep on improving. There's continual improvement. Whenever you sit, then you set new targets and then you move as a team.
Dr. Muwanga, you speak like a pro in this whole business, and I think it actually shows in terms of the accreditation of your lab.
Yes.
So I think there is so much to be said. I see a lot of questions coming up at this point, but we're going to hold on the questions. Please just keep on typing in your questions, and we'll come to questions in a few minutes. Dr. Muwanga, please don't go anywhere yet. Let's go and listen to...
I'm with you. Yes.
Okay, thank you. Thank you. Let's move on and see. Let's go to Reverend Father, Dr. Okori from St. John the 23rd Hospital, Aber. Please tell us what has been going on with accreditation in your institution and what the journey looked like for you.
Yes, thank you. Good afternoon. I have a PowerPoint presentation. Could the team please...
As we get ready to share Dr. Okori's presentation, I think what we listen or what we hear when we listen to Dr. Muwanga is these are some of the very clear benefits of this whole exercise of accreditation. But again, when it's just not the accreditation, it's accreditation and talking about the SDG 3, which is directly on good health and well-being. So when Dr. Moses is talking about the kinds of things that his hospital can do, it's just not the hospital doing those things, it's actually patients benefiting from the fact that they have a system that is standardized, they can get results, and the results are accurate and reliable. I see Reverend Father Dr. Okori's slides are up. I will turn over to you now.
Yes. Yes, good afternoon, and thank you for this opportunity. I'm Dr. Okori from Aber Hospital. I'm going to share with you how accreditation has improved the health service delivery in Aber Hospital. So you will have to keep going to the next slide. Aber Hospital is a private, not-for-profit. So this is the outline that we are going to follow. The introduction and our journey towards accreditation and the beneficiaries of accreditation. As we can see, the patients, the lab staff, the hospital as all, the clinicians, and the public. And I will give a concluding remark at the end. Next slide, please. So St. John 23rd Hospital Aber is a private not-for-profit. 4 years ago, we had a 178 bed capacity. Now we have 220, and we have included emergency unit, nutrition, and neonatal unit. It's a general hospital, a referral hospital in the district of Oyam in northern Uganda. We have major disciplines, surgery, medicine, pediatrics, and OB-GYN. And this year, we received the first cohort of 8 medical intern doctors. And we are grateful that we are able to train the doctors. Next slide, please. So what you see there is just the person in orange is standing on the lab block. It's a block where the lab is situated in the hospital. On the left is the operating theater, which is about to be completed. And the next slide will show us the lab staff inside at work in the hospital. So you can see that is the lab that has been accredited, and can see the lab staff at work in the hospital, in the lab. Next slide. I'd like to talk about why do we exist? What is the reason for our existence? We keep our eye on our mission. Are we faithful to the mission of the hospital or the mission of Christ that we are to bring healing to our people? There are 4 parameters that we actually keep our eye on. The first one is accessibility. Are people, is the community able to reach us, to come to us for care? Are we accessible? Are we equitable? Are we fair? Do we take care of those who are less privileged? For example, we have reproductive maternal child health. We have mothers who are pregnant who can't afford maybe the cesarean section of 1 million. So here in the hospital, the charge is 40,000 for admission, for deliveries, for treatment until they are discharged. That is part of the equity that we take care of our people. And then also children less than 5 years old, they pay 20,000 for admission, for treatment, for everything. So that is important. And then the third aspect is efficiency. We have limited resources. So how do we use the limited resources we have? Avoid wastage of energy, of water, of resources that we have, of reagents, of lab supplies, and of the things in the hospital. Number 4, we take care of, keep our eye on the quality. When patients come to us, are they going to be safe? Do we take care of patients' needs, preferences, their values? Do we involve them in clinical decisions that we make together with them? And then do we make correct diagnosis? It's not just making diagnosis. Is it a correct one? Do we give them the correct treatment? Do we listen to their rights? And also what we do, is it evidence-based? So these are the 4 parameters that we really keep our eye on as we take care of our people. Next slide, please. I'd like to talk about the journey towards accreditation. This journey started all the way back in 2010, when Uganda adopted the SLAMTA, strengthening lab management towards accreditation. And Aber Hospital was enrolled in 2014. Over the years, we have had 7 audits between July 2015 to September 2020. And we have had scores from 0 star to star 4. And in 2018, in October, we were certified by the African Society of Laboratory Medicine after the audit. And in 2020, September, we were audited by the South African National Accreditation System, and we were recommended for accreditation. And this year, 31st March 2021, we got the certificate of accreditation. And I'm going to now talk about, in the next slide, how this journey has been. This journey, I like to mention clearly, first of all, from unconscious incompetence, the lab. I mean, the whole system, we are not aware of the skill and knowledge gap. Unconscious and incompetent. We are doing work, yes, but there was no consciousness. So from unconscious and incompetent state, we moved to conscious and incompetent. So that was the beginning of learning. We were being helped from UCMB, Uganda Catholic Medical Bureau. We also put in Aber Hospital. We got some mentors to come in as a hospital. Implementing partners, we had Sustain, we had Rights North Langu, QPHL came in, Central Public Health Laboratories from the ministry, and a Global Healthcare Public Foundation. All these have been mentors, facilitators on this journey. We have come to a conscious and competent level. That means we have the skills, we can perform the task, but it requires practice and hard work. There is the last slide that I'll talk about, where we need to be at the unconscious competence that is needed for sustainability. So the case for accreditation for Aber Hospital, this is an essential tool, an essential step that contributes towards the good health for all patients in Aber and beyond. So this is a contribution to the realization of the Sustainable Development Goal number 3, good health and well-being for all and at all ages of the United Nations. So I'm going to talk about in the next slide how accreditation actually benefits. Who benefits from this? Who are the beneficiaries? The patient actually is a beneficiary by improving the quality of care and patient care. Patients are satisfied, better clinical outcomes, better treatment, shorter stays in the hospital, and also appropriate use of antibiotics because we're able to do blood culture, we're able to do culture and sensitivity. Our patients don't have to travel all the way to Gulu or Kampala to do investigations. They are here in the hospital. Don't have to go far. Next slide. Yes, not only the patient, even the lab staff, they have become more competent, more efficient. The knowledge of quality management system, their knowledge and skills, they are not the same people that I knew 5 years ago. They had specialized trainings in internal audit, in management reviews, statistical process control, and there is team spirit because they have a baseline of knowledge. The communication between the staff and other members of the staff in the lab has really improved. Next slide. Yes, the lab staff are being called upon to provide capacity building within the region. They are being called upon to go and mentor some other facilities who are on their way, who are moving towards accreditation. At this point, the lab staff are aware of what is needed in the lab. The supply chain, the training, the equipment maintenance. How do we go about this? So they are more responsible and accountable. I can rely on them to identify gaps and work to fix them without me coming around and saying what is going on. So they are more responsible. They are good stewards and they own what they do. Next slide. Yes, it's not only the patient and the lab staff. We have trust from the people who come to us. The perception of the hospital has improved because of the accreditation. The community has confidence in what we do. We are a reference lab. We are a hub, a reference lab, a referral hospital for investigations. the patient flow and test volume has increased, and the hospital has a commitment to quality of care and patient safety, and this definitely results in best clinical outcomes. Our lab is used as a benchmark for other laboratories. They keep referring to us, not only for lab, but also for other departments in the hospital. So the lab is actually a center of excellence because of accreditation. And it stimulates also continuous quality improvement, not only in the lab, but in the whole hospital. Next slide. Yes, this has resulted also in the efficient use of limited resources in the hospital. The lab cost of operation has reduced, even though the demand has gone up. They are able to use rationally the resources that we have. And then also, we continue to evaluate our performance in relation to standard. What is the standard saying as we perform? And there is job satisfaction. I don't think the staff in the lab are willing to leave the place. Why would you leave the hospital and then you go to Health Center 3? You cannot leave an accredited lab. So we are also getting a lot more insurance companies. AR, last 2 weeks, we actually had an MOU with Prudential because they know there is value. Yes, next slide, please. It's not only the lab staff, but the clinicians, the doctors. The doctors have more confidence in the results from the lab. They respect the people in the lab now. In the past, they used not to care. But the doctors have a lot of respect for the people in the lab. There's an improvement in communication. The doctors are able to make a correct diagnosis, prompt treatment, and also predict prognosis. So this is how the accreditation has helped even the clinicians. They are more confident in the results from the lab. Next slide. The community, the public look at us in a different manner because now they know we provide safe care, fewer risk and adverse effects. The customer satisfaction survey, we did a customer satisfaction survey. The patients were clearly said we will be able to come back, or we recommend this hospital to our relatives and to our friends. Accreditation also tells insurance companies and the community that we value safety, we are reliable, we offer quality, there is value for money, and tells us that we are committed to best practices. I have put there in red the visibility. Now, the people are able to call us, let's say the insurance companies. Many other hospitals are calling us for benchmarking. We are now visible. In the past, they used not to see us, but now we are actually visible. They can now call us. In the past, we would call them and they say, where is that place, Aber? But now they can call us and say, yeah, we are here. Next slide, please. Yes, these are my concluding remarks. First of all, achieving accreditation is one thing, but we have to sustain. That is in my last, when I talked about competence, we need the competence that is unconscious. What do I mean? Those who have enough experience with skills and they can perform easily, become second nature to them. Then it also requires effective leadership and good governance, the commitment of management or the hospital to improve quality. We also need to have these services available. Are they available? Are they safe? Are they accurate? Are they timely? Are they affordable? And must be on need of the patient. Lastly, there's need for an inbuilt mechanism for continuous checking of the various processes of the healthcare delivery so that mistakes are stopped before they are moved to the next stage. There are no shortcuts. I think here we just keep saying there is no sorry. There's no sorry because you cannot just make a big mistake and say sorry. Next slide, please. Next slide. Yes. So that picture, this was on the 29th of May when we had the commissioning of the lab and the presentation of the certificate of accreditation by the former Minister of Health, Dr. Rosa Cheng, to the director and the chairperson board. And that was 29th of May. Was also a day for commissioning of the CT scan machine, the first CT scan machine in northern Uganda. The next slide, please. Yes, that was the picture of the day when we have, I can see Professor there, and we had 3 bishops, Archbishop Odama. Sandra is hiding somewhere near me. All right, so thank you. I'll stop here. Thank you so very much. Thank you.
Okori, can you hear me? Dr. Okori, can you hear me?
Yes, I can hear you, Professor.
Okay. I was just going to say that you make such a great business case for accreditation and specifically the support of the SDG3. I wish I could have actually gotten you onto the business team and not the medical team. But you touched on some really important things when we're talking about benefits that weigh both for the accreditation of the laboratory and for the patients as well, which actually directly supports the SDG3. You talk about reduction in waste. That's one of the most important things that we look at, because when we're talking about low-income countries or resource-poor countries, you cannot afford to not be able to account for every drop of reagents that you use in testing. And I think when you talk about reduction in waste, that is something phenomenal that you're able to reinvest. The return on investment for your accreditation process certainly pays that you're able to support more patients with the same amount of commodity that you had before. And you actually touched on something else, the whole element of diagnosis. One of the big things that accreditation brings to the table is the fact that now with an accredited laboratory, you spoke about visibility and people now know where you are, but people don't just know where you are, people are actually more appreciative of the fact that they don't have to repeat tests. And the reason why the insurance companies are calling you is because when they think about the payments that they have to make, before they most probably had to make 3 payments for 1 correct malaria diagnosis. But the reason why they're calling you now is because they are more convinced that they're going to make 1 payment and they're going to get the right diagnosis, which is very important. And that's one of the big benefits of the whole accreditation and ensuring sustainability and satisfaction to your patient. But also you talk about visibility. I have in the recent 1 month actually made 2 trips to St. John the 23rd Hospital, Aber. Who would have told me that I would have made 2 trips that far from Kampala in 1 month just because of Aber? That's a testimony to exactly what you're talking about, the visibility of the hospital and what is going on there. Now, what would be important also for our viewers to find out is, in terms, what kind of volumes are you now seeing because of accreditation in terms of patients, clients?
Yes, thank you, Professor. Before accreditation, we used to have patients coming from nearby, but now we have patients coming all the way from Lira. Lira is a city. Lira is a city, and has so many laboratories over there. It's a city with over, I think, 5 hospitals, but they have to travel 1.5 hours away on a bad road to Aber. So the number, let's say we used to see about 100 in a month. But now we are even going to over 150, over 200 patients in terms of those doing CBC and those doing chemistry and all these other investigations. That is what I mean. The test volume and also the patient volume has really increased. So that is the increment I'm talking about. In terms of actually numbers, they have actually increased.
That's a really important thing, because before the question would simply have been what's your catchment area, and you would have given some really small number. But now it actually looks like you have the whole of northern Uganda that you're responsible for. Am I correct when I make such an assumption?
That is correct, because they get to ask us every time they keep calling, are you able to do this kind of test? Are you able to do this kind of test? And now it's made even more complicated by having a CT scan machine. They think now the CT scan machine is going to do everything, and you have the CT scan machine, you have the accredited lab, then this is the place to come to. So that is the meaning.
Dr. Moses, I hope you're still there. For you, I remember your story very well, and you just left from Entebbe Hospital to Entebbe Regional Referral Hospital, right in the middle of the accreditation game. Tell me what the impact was of the accreditation, the whole element of quality improvement, how it actually allowed you to make that transition. Because I remember that all happened for you within a month. You were a general hospital one day, and the next day you were a regional referral hospital. And here you were going for accreditation.
I think that the process of accreditation helped us to increase our test menu. And initially, before we became a regional referral hospital, we're a general hospital. We happened to be a hub. A hub means we are supporting labs in over 6 districts. So these smaller hospitals would bring in their tests. So we have hub riders who would go around these districts collecting samples, and then later they had to bring them to the hospital. So that one played a very crucial role in ensuring that we become a regional referral hospital, because ideally we're acting as a referral laboratory for many of these smaller hospitals and health centers. So it helped us in one way. Although after accreditation, our test menu became bigger, but the volume of the patients and ideally the samples brought in by the hub riders, and that one was backed with the local hospitals had in the results we are producing as a hospital. So I think it was one of the reasons why we had to be uplifted by the Minister of Health to support the surrounding area.
Yeah, indeed. Just what are some of the constraints that you now have because you're a regional referral hospital?
The constraint is our catchment area was made wider. So we have to serve quite a very big population. Then we also have to serve more laboratories by supporting them as a hub system. So I think in terms of the number of tests run, the area covered increased, the clientage also increased. So you find if you are to match the resources versus the number we are supplying, even the resources, we are supposed now to work with limited resources to ensure that we cover quite a big area. So the mere fact that we had a proper system set up, it helped us in a way that we could now use the limited resources to ensure that we manage to serve many of these areas. Then also the reporting system, because if we didn't have a proper reporting system, I'm sure we would have had a lot of problems with ensuring timely results for many of these labs. And then patient care would really be a very big problem. Then those who can't use the hub system, they have been referring their patients into the hospital. So I think those patients referred, they get proper clinical diagnosis and then proper clinical care, which I think has been a plus on our side. And accreditation has really played a very crucial role in our providing proper quality services and patient care.
Thank you so much indeed. These are very good examples. I continue to leave the slide on just so that people see how dispersed the accredited labs are and the actual access, which Reverend Father Dr. Okori mentioned. The access because of the accredited labs is actually widening. And it is the Ministry of Health's agenda to get another 20-25 more labs accredited in the next 5 years. And I think Uganda has done a phenomenal job at doing this, and that is extremely possible as we look at the speed. But then for both yourself, Dr. Muwanga and Dr. Okori, you now are running facilities that have been accredited. So suddenly you have the honors of having to support the lower laboratories in terms of building up their own management system, in terms of strengthening their quality improvement programs. Is that something that you've already factored in as part of the accredited lab in the country? Is this something you're already doing? Let's start with you, Dr. Moses, since you're already on.
Yes, I think we are supporting the lower labs. It's not easy because, as you know, it's quite a difficult journey, but we are trying to support them with the quality management, to try to set up protocols, to try to give them, because many of them we allow part of their staffs to be attached into our hospital such that they can see what goes on. Then later we visit the lab and see what are some of the systems they're having on ground. Because if we support these smaller labs, then somehow we limit the number of referrals. There are some basic tests they can do down there, and then referrals are limited into our hospital. So I think we are trying to do this as a hospital, and ideally it's part of our mandate as a regional referral hospital to support these lower facilities to ensure that small quality management care can be done at their place. Then partly what they can't do is refer to our facility.
Let me give the same to Dr. Okori. In terms of your support to the lower facilities.
Yes, Professor.
You are actually deemed a lower facility.
Exactly.
In terms of your actual practice, you are not a lower facility.
Exactly. That is very true. Is what I was going to say, because now, how can we go to Lira Regional Referral? They are big. Big is big. So how do we go to them? But the fact that we are a accredited lab, we actually have to make it a strategy to help the lower labs to begin the step, to begin to be conscious, to understand and to be aware of the knowledge and skill gaps that are there. We have a lab training school in Lira, and some of our lab staff, the technicians, are actually in school, and the teachers or the tutors in the lab there are planning to come and visit our lab so that they can be used as a point of teaching, a reference point of teaching. But our staff are being picked to go to other labs, like in a patch, they can go to college. That kind of mentorship is actually, that is not yet an official way, a general hospital compared to Lira Regional Referral, that is, we should be referring to them for mentorship. Can you hear me?
Yes, I can hear you. Actually, I was just looking at one of the questions that actually came through for you. And it's actually, as you've already alluded to this, but I'll just ask you again. You say, how has the accreditation status enhanced demand for laboratory service at Aber in terms of uptake by users of laboratory services? You already alluded to that, but you could repeat your answer.
Yes. But I can still add that, yes, we would like to be sustainable. Part of the sustainability is actually to continue to do things right with the limited resources. It is true that the donors will leave or the IPs will leave. Actually, at this point, the lab is actually, we have the support from A Global and some few donors, but we are already on the track towards sustainability on our own. as long as we are able to provide the right menu on the table, people will come, and that will actually take care of the part of the sustainability. It is a process, and we think we are on the right track, and these are the things that we are already thinking about and working on it.
Thank you. I just throw the same over to Dr. Moses. Now you're a regional referrer. There is a growth that has to happen in terms of your capacity in-house to be able to manage the client volume that you're going to get. But then all of a sudden, all of these people are going to come running to you. You're accredited, you're a regional referrer. And what is the mechanism you are putting in place to be able to ensure that you do not lose the accreditation of your laboratory, but you think about sustainability and also think about certification, for example, of your whole facility?
Yes, I think what we have done is we have in our strategic plan, we have just finished our strategic plan. So sustaining this lab has been part of the strategy we have put in our strategic plan. We have incorporated the lab activities in part of our annual work plans, such that we have to find areas of how we can support these lab services, because they need funds. In one way, we have tried to ensure that the hospital budget puts in some line whereby a lab is supported to ensure that this quality management system has some money to ensure that it's sustained. Advocacy is one area, because we can not only believe that government can sustain it, so we are using collaborators. Just as I told you, internationally, we have brought in people to work with, like the University of South Corridor. They are working with us. That accreditation will help us to write research proposals, such that we can get some funds whereby some of these activities, which are supposed to be carried out in the lab, are sustained. We have to look at the human resource, because minus proper human resource within the department, there is no way we can sustain this. So we are using the people who have been in the process of carrying out the accreditation, and they have all this knowledge, so that the new people who come on board, the capacity is passed on to these people. So I think this has been incorporated into our strategic plan, because sustainability, if you don't have a budget to ensure that many of these activities, which are managerial requirements as well as technical requirements, have to be incorporated into this. We need to support these people, especially in areas like maintaining the services for the various equipment. We have to ensure that that is done. The reagents per se, these are some of the things we need to do. Even the mere managerial review meetings, these meetings need to be supported with money. So somehow, as a hospital, we have taken it on to ensure that at least it's something which we keep on incorporating in our hospital budget.
Okay, thank you, and thank everybody who has joined us for just about the top of the hour. I'm going to ask you, Dr. Muwanga, to please give us your parting words. This is something that clearly is very passionate to you, the whole element of accreditation of your laboratories. But again, it's not just a laboratory, it's a medical laboratory, and it strongly supports the SDG 3, good health for all at all ages. So please give us your parting words on that.
Thank you very much, Professor, and thank you for the opportunity. I want to tell everybody that really providing quality services, especially in the lab, it's paramount. Laboratory services are part of the basic services in clinical care. You cannot provide proper clinical care when you don't have a proper laboratory services. And that can be done if your lab has systems, processes, and there are also better managerial systems as well as technical systems. So we always need to have most of our lab. Ideally, I would recommend that we can have many of our labs accredited, because this is a system which is set up. It can help you. It improves the quality of the systems. It also helps to ensure that we minimize wastage of resources. There's a proper system. The people know how to use the limited resources for the better output. And I think at the end of the day, there's safety for the patients as well as for the users of these services. Thank you very much.
Thank you so much indeed. I'll go on to Reverend Father Dr. Okori. I'm also told that there are a few people who have raised their hands. So please, Dr. Moses, this is a little awkward, but we'll listen to Dr. Okori and then we'll take 1 or 2 hands before we close for today.
Yes, thank you, Professor. I would like to acknowledge that I have many attendees online. Ellen attending all the way from Netherlands, from Rotterdam University, and she is very particular about the laboratory accreditation, and she is actually smiling over there, I believe. And we are happy to have many other of our staff listening and watching and paying attention to this important discussion. I'd like to say lab accreditation can happen, and we at Aber Hospital, we know that we are a rural hospital, but it's not the location, it is the content of that location. And that is what we are so proud of, that we can take care of our people here in this rural area. They don't have to travel far and wide. We offer accurate, reliable, timely, and quality service to them. So I'd like to thank you all, and I thank you so very much. Thank you.
Thank you so very much indeed. I think there is Esther who has raised her hand. Esther, please just go on and tell us where you are and tell us to whom you're directing your question. Esther, if you can hear me, you need to unmute. Let us know to whom you're directing your question and where are you actually dialing in from. There is another hand. I think that's Stanley. Stanasius, I think that's the name. I'm sorry if I really butchered your name. I'm really sorry. I'm very sorry. Yes, no, please go on.
Professor, I know when I'll charge you when you'll be back to Nairobi at some point. My name is Stanislas Masinza from Kenya Accreditation Service, which is the accreditation body for the region. Established in Kenya. We have clients in Uganda. I'm happy to see your map, and you can see NEC. NEC is one of our clients. I just wanted to make 1 or 2 comments. One is that thank you, Global, for setting the stage in Uganda. We have worked with Global in accreditation of many laboratories in Kenya. So actually, congratulations to Uganda. You are on the right track. Secondly, I want to maybe, Professor, you correct something. You cannot say that you are recommending SANAS for Uganda. Accreditation bodies are not in competition. We are actually MRS signatories, and there is cross-frontier policy which we all follow. Uganda is an EAC country. The first allegiance is to EAC and then to any other. So feel welcome to contact us whenever you need anything, information, training, anything. We work very closely with the partners such as Global, and we really appreciate the work they're doing in ensuring that Africa, particularly East Africa, we enjoy quality services. SDG number 3, which is about good health and well-being, starts when we actually get the correct results, reliable results, believable results to our clinicians for them to make the right clinical decisions. So laboratory accreditation, particularly in the medical field, is so crucial to the attainment of that SDG number 3. So thank you very much. Congratulations, Professor. This is important, the meeting you've just had, because the whole world is coming together to discuss or to appreciate the role of accreditation in the attainment of SDGs. So I'll be dropping my email there in case you have any question, any comment, any reaction. I'll be more than willing to engage you outside this forum. Thank you very much.
Thank you so much indeed for your comments. Thank you so much indeed. And you're very right. Global Healthcare, we've worked with KENAS and we've worked with almost all the accrediting bodies up there. And let me be very clear, I did not recommend standards for Uganda. That is a decision that has been made by the Ministry of Health. And we are just an implementing partner in the country. So I'm not making a recommendation. I'm actually just executing a directive by the Ministry of Health in Uganda. But again, I strongly recommend all laboratories in the private sector and the public sector. These are all accredited, these are all recognized. They all have their mutual recognition agreements with ILAC. They are all on the continent and very clearly stated and very well said. So please contact and move your labs to the next level. Tomorrow is going to be World Accreditation Day. It's going to be a really big day for all the SDGs. But for those of us in healthcare, it is going to be an even bigger day as we look at the SDG 3 for good health for all at all ages. So just before I come to a close with this, greetings from everybody at the Global Healthcare Public Foundation. Happy World Accreditation Day 2021. We wish you all the best and hope that the quality of your results, the reliability of your results continue to stay unquestionable from this day going forward. I never want to end any of this. We all know the times in which we are in. Stay safe, wash your hands, soap, running water, 20 seconds at the minimum, sanitize as much as you possibly can. And please, by all means, I'm not wearing a mask, that's true, but that's because I have a huge room and only two other people with me here. But please wear your mask, wear your mask, wear your mask as often as possible. Maintain a reasonable social distance all the time. Don't tell me that you're home. Don't tell me that you're with your friends. Sometimes good public health is making sure that even your friends are your enemies. Take good care of them. I thank you for joining us today. I look forward to seeing you at our next webinar. We're going to continue doing this. We'll continue to bring you some more information on the subject of accreditation and international standards that can be used to strengthen our systems, regardless of what the business is that you are in. That's what we do at the Global Healthcare Public Foundation, and it's always a pleasure. Till then, you could reach us either by direct email, you could call us, send us a Facebook link, or you could actually visit our Uganda office. That's one of our closer offices. For those of you who are here, we look forward to hearing from you soon. Thank you and have a wonderful afternoon, wonderful evening, or a great rest of the morning wherever you are.